Well, if you're still finalizing your healthcare plans for next year, you will need to act quickly. Open enrollment ends this weekend for Coloradans looking to enroll in, change, or cancel health insurance plans.
That decision can have a big impact on the coverage you receive when you get sick or hurt. Dr. Payal Kohli joins us now. And Dr. Kohli, choosing the right coverage can sometimes really just feel like a gamble for your own health. So why is health insurance so complicated here in the U.S.?
Oh my gosh, it is so complicated. And even we as physicians honestly have a hard time sort of wrapping our heads around it and explaining it to our patients. And a large part of that is that we're very fragmented. So if you think about the UK or you think about Canada, it's a single payer system, right? One insurance company, one payer. Here, you've got government payers like Medicare, Medicaid, you've got private payers, you've got employment payers, right? A lot of people get their health insurance from their employer. And this all started in World War II when employers were giving out health insurance to sort of seduce people to come work for them. But it's really created this a little bit of a mess where people don't understand their plans, they don't understand their coverage, and then plans keep changing. And then there's lack of something called cost transparency. So if you walk into a Starbucks and order a coffee, you know exactly how much you're going to pay for it. But you could go to a doctor, get a visit, and be charged either different amounts depending on what happened or not know till the very end. And we, even as physicians, might not know.
Probably something you see pretty regularly with folks who learn this lesson after the fact, maybe the hard way. What should people be thinking about right now as they make that decision for next year?
So I would say look at your healthcare consumption. If you're somebody who uses a lot of healthcare, then you want a low deductible plan, because that deductible is the amount you have to pay until you sort of become responsible. And if you're someone who's pretty healthy, doesn't go to the doctor very often, you could get away with a high deductible plan with a lower monthly premium. So how much healthcare are you using? How much your drugs cost? Because that could help you pick which plan you want. So call up a healthcare broker and say, you know, I'm on these drugs, which plan covers it? Which doctors are in your network? This is a big one, because I get patients in my office, I see them. I don't know if they're in my network or not. I can't really tell them until I run their insurance, and we find out after the fact.
What else should people check for as they're deciding on a physician?
So that network coverage is really important, whether or not it's one of your insurance company's preferred physicians, because there's some physicians who spend less healthcare dollars that insurance companies kind of push towards that they prefer them to take. And then when you're getting any kind of healthcare service, you want to be really, really informed, because I have patients who come to me and say, but Dr. Kohli, it was covered. But they don't understand when the insurance company says, yes, that is covered, there's a cost sharing. So that doesn't mean you don't have any out-of-pocket responsibility, because you could have a high deductible, you could have a high copay, you could have a high co-insurance. So I generally tell people, call the insurance company and ask, what is my responsibility, not whether it's covered or not.
Following up on that, how can these companies deny claims from a doctor?
Yeah, so this has caught me off guard. Once I went into private practice, I sort of realized it, but there's many ways that they can deny it. So there's something called a prior authorization. So if I'm ordering an MRI on you, if I don't ask for permission from the insurance company, they could come back later and say, well, you don't ask for permission, so it's denied. So make sure your doctor has obtained, either for an imaging procedure or some other type of procedure, surgery or anything, a prior authorization. Make sure it's filed in time, because there's a time limit after which it expires and when it's no longer covered. And the codes that they use to file it could determine coverage. So you could talk to your doctor and say, is there another covered code that you could put on this claim and help to appeal it if it gets denied?
We know that these can really add up, right? These procedures, these tests can all be really expensive. What should people be doing before that?
So if I'm sitting in my doctor's office, and this happened to me recently, they order a test or a procedure, you call the number in the back of your card and you say, my doctor has ordered the CPT code. So you get the code from the doctor of the test or the procedure. You get the diagnosis code, why they ordered it, from the doctor. And then you say, what is my patient responsibility? And they'll put all that into a calculator and look at how much you've already spent, what your deductible is, copay, coinsurance, and tell you exactly what your health care should cost.
End of the day, this is on the patient to make sure these things are covered. Even if the doctor says you need it, you need to do that extra step.
Such an important point. And I think that's where things get lost, because we sort of think, okay, I have insurance, it should be covered.
Yeah.
But it's so much more complicated. So it's up to us to take control of our health insurance.
Awesome.
Thank
Great.
you so much.
Yeah, great stuff as always. Thanks. Appreciate it.